Hey, it's Dr. Thornell with New England Family Chiropractic, and this conversation came up in the office yesterday, and I thought it was important enough to take 2 or 3 minutes and explain it here. And the conversation was this. For some reason, people don't have any problem understanding that their spine, that their low back, can cause sciatic pain, which is the pain that comes from the lower back down into the rear end, through the hamstring, and then down into the calf, and frequently all the way down into your big toe. And for some reason, they can make that connection. They can say, yeah, my back is what's irritating the nerve. The nerve then runs down into the leg, and that's where it comes from. But yet they have a really difficult time getting that concept everywhere else in their body. When people have numbness in their finger, they go, oh, geez, it's in my finger. How can that possibly come from my neck? And it confused me. It makes it hard to understand for me, because when we talk about sciatic pain, nobody has any issue with that. And that's as far removed from the brain. And we've got to travel all the way down the spinal cord, down the sciatic nerve to create numbness in the foot. And yet they relate that back to the spine. But yet the hand, or the thyroid gland, or the lungs functioning properly, all of that stuff is a lot closer to the spine than the numb big toe. This they can understand, these they can't. And the lesson is, it all works exactly the same. If we want to have normal sensation or normal function in our hand, it takes the brain being able to send electrical signals to the muscles of the hand that say contract, and they do. It takes the ability of the receptors, the sense and touch receptors in the skin, to be able to send electrical signals back to the brain. And that's what makes those things work properly, just like what makes the leg work properly. And when those signals are being distorted, pinched, and irritated by an unhealthy spine, then we A, may not get normal function, B, we may not get normal sensation, because the information coming back from the hand to the brain doesn't get there properly, and the brain can't perceive what those sensors are telling the brain. So it's no different if we're talking about sciatic pain in the leg, we're talking about a numb hand, or we're talking about lung function and somebody who has asthma. We're talking about an immune system with all these little white blood cells that isn't functioning properly. Those things, when they don't work properly, when they become dysfunctional, it makes perfect sense to come back and say, well, is there a miscommunication? Is there distortion in the ability of the brain to run those things properly? Now, for those of us that have been around chiropractic care a long time, that's pretty basic information. But believe it or not, for most average people, that is like groundbreaking information. They've never heard how their body works in those terms, and why they would ever come back and look at their spine as a cause for asthma or for poor immunity. So this is a great video if you have somebody who says, no, yeah, I've heard about chiropractic, or they think it's just about back pain. This is a great way to sort of dip their toe in the water of information, so that they can start to understand how and why chiropractic can impact so many things.